Family Health is here for you. Family Health is a 90-minute program that looks into the psychosocial and clinical aspects of the society.
With our resource persons, we discuss health issues in down-to-earth terms.
Join us every Thursday from 12:30 p.m. to 1:55 p.m. on 88.4 Royal FM, the Listeners Radio, and live on Facebook at Royal FM Cameroon.
Family Health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease for infirmity. Health is wealth. You want to learn about health? Family Health is here for you. Family Health is a 90-minute program that looks into the psychosocial and clinical aspects of the society.
With our resource persons, we discuss health issues in down-to-earth terms.
Join us every Thursday from 12:30 p.m. to 1:55 p.m. on 88.4 Royal FM, the Listeners Radio, and live on Facebook at Royal FM Cameroon.
Family Health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease for infirmity. Health is wealth. You want to learn about health? Family Health is here for you. Family Health is a 90-minute program that looks into the psychosocial and clinical aspects of the society.
With our resource persons, we discuss health issues in down-to-earth terms.
Join us every Thursday from 12:30 p.m. to 1:55 p.m. on 88.4 Royal FM, the Listeners Radio, and live on Facebook at Royal FM Cameroon.
Family Health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease for infirmity.
Thursday, October the 30th, 2025. Ladies and gentlemen, good afternoon and welcome to yet another edition of your favorite health program, Family Health, on Royal FM 88.4. On each edition, every Thursday we discuss health, and today we are going to look at breast cancer, as it is still Pink October, the month dedicated to breast cancer awareness. And for that, we are going to be having a guest in the studio who is going to be shedding light on everything we need to know about cancer, breast cancer, and also what is done so far in order to curb breast cancer and create awareness. Aside from that, in the program, we are going to have our lone slots, the discovery page done by Glory Gange, and also beautiful music to entertain you this afternoon on the program. Stay tuned as we begin with the gospel music. But before, we would like to remind you that we have a technical team assisting us this afternoon. It is made up of Romeo Adekume, our sound engineer, and our studios clerk. Brian Bida is our video editor, and for editorial coaching is Abel Bila Samari. Coordination is Roger Kiekan. For general supervision is the Reverend Pastor Bisaya Emmanuel Noel. For presentation, my name is Frinwe Crispin. We are going to be together from now to 1:30 p.m. Let's begin with our gospel music.
He's gonna work it out. Yes, he will. Before I knew my name, and before I drew a breath, oh, he was making ways for me. Now and every day, and in each and every step, oh, he is making ways for me. My heart is full of doubt, feels like my faith is running out. I'm too far to turn around. I know that God will work it out. God will work it out. One thing I know, one thing I found, my God will work it out. Come on, work it out. Watch your money works it out. Work it out. Watch your money works it out. Work it out. Watch your money works it out. Work it out. Watch your money works it out. I've been pushing past the fear. I've been fighting to believe. Oh, He's making ways for me. Yeah, and He won't let me down. No, He'll never ever leave. No, He's still making ways for me. He's still making ways. My heart is full of doubt. Feels like my faith is running out. I'm too far to turn around. I know that God will work it out. I believe that God will work it out. One thing I know, one thing I found. Yeah, God will work it out. Be still my soul. Be still and know my God. He's in control. He's in control. Be still my soul. Be still and know my God. He's in control. He's in control. Be still my soul. Be still and know my God. He's in control. He's in control. Be still my soul. Be still and know my God. He's in control. He's in control. Oh, be still my soul. Be still and know my God. He's in control. He's in control. Just be still. My soul. Oh, be still and know my God. He's in control. He's in control. Be still my soul. Be still and know my God. He's in control. Because God will work it out. Come on, sing it out. One thing I know, one thing I found, one thing I know, found, one thing I know, one thing I know, one thing I found, one thing I know, one thing I know, one thing I found, one thing I know, one thing I know, one thing I know. God is working it. One thing I know, one thing He's working everything together. One thing I know, one thing He's working everything together. Yes, He is. One thing I know, no, 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 no. One thing I found, one thing I know. He's working it all together for my good. Yes, He is. One thing I found, one thing I know, one thing I know, one thing I found, one thing I know, one thing I found. My God will work it out, working it out. He's good like that. He's working it out. He's good like that. He's working it out. He's God like that. He's working it out. Yes, He is. He's good like that. He's working it out. He's good like that. He's working it out. He's God like that. He's working it out. He's good like that. He's working it out. He's God like that. He's God like that. He's working it, 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 working it. He's working it, working it. He's working it, working it. He's working it, working it. 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 That's just what He does. That's just how He is. He knows how to make a bad thing turn to good. He's working it, working it out. He's working it, working it out. 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 Working it. Good like that. He's working it out. He's God like that. He's God like that. He's working it, 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 working it. He's working it, working it. He's working it, working it. He's working it, working it. 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 That's just what He does. That's just how He is. He knows how to make a bad thing turn to good. He's working it, working it out. He's working it, working it out. 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 Because God will work. Come on, sing it out, sing it out. One thing I know, one thing I found. My God, God will work it out.
Royal FM. The time is 1 p.m. and you have the power in your hand. Subscribe to Orange Data Bonus on #111*1# to stream, surf, or download your data. Orange.
If you are just joining us this afternoon, you're on to Family Health, and on Family Health today we are discussing breast cancer, and it is the pretext or the reason for this discussion. It is as a result of Pink October. The month of October is dedicated to breast cancer awareness, so we are going to be talking about it with a health expert here in the studio. But before that, we would like to let you know that our lines are open for calls, for interactions, in case you have any contributions to make this afternoon on the program, depending on the topic of discussion. On the topic of discussion, you can reach us on 640-613842, 640-613842, or 671-157321, 671-157321. We are waiting for your diverse calls, for your diverse reactions on these different lines. Time for us to welcome our guest of the day. His name is Prince Boateng Asonganyi. He is a nurse. Good afternoon to you, Prince.
Good afternoon, Crispin.
Okay, how are you doing?
I'm doing great today.
Okay,
I'm happy to be here today.
thank you. How has your week been so far?
A bit stressful, but work. We have to just work and go ahead.
Why is it as if you've put on small weight?
Really?
Yeah, and you're looking fresh.
Thank you.
It's good. At least from the last time, it was last year that we.
No, not last year.
It's this year.
I think it's this year.
This year.
This year.
Okay, this year. Yeah, this year we were together here, but maybe it was at the beginning of the year.
Yeah, exactly.
Okay. All right. From that time to now, if you've put on some more weight, that means it's in any show. What did the enter? All right. You are here today to make to spread knowledge, create awareness about breast cancer. It is Pink October, breast cancer awareness month, and we are almost done with the month. Today we are almost the second to the last day of the month of October. So we said, why don't we conclude the month with this topic of discussion, breast cancer? Before we start talking about the activities organized and other things that have been made in order to create awareness about breast cancer and fight breast cancer, we would like to first of all know from you, Prince Boateng, what is breast cancer?
Okay. Breast cancer is a condition where the breast cells in the breast continue to grow abnormally, causing it to spread to other parts of the body.
Okay.
And if not treated or detected early, it can cause more harm, further harm in the body.
Okay, that's it. Let's come back now to Pink October. Why Pink October? Why do they choose the month October to dedicate breast cancer and create more awareness? Why all of this? Why the choices? And
Okay, Pink October is a month that is dedicated to spread awareness on breast cancer, and all these are efforts that are done, because when efforts are done, it makes more awareness. It creates more awareness to other people, and when it creates more awareness, it has been done through local and international organizations.
okay,
Through local and international organizations, NGOs efforts, such as they raise also fundraising events where they meet these breast cancer patients and try to encourage them that they are supported and they are needed in the society.
okay. Now, so far every year you organize activities to combat breast cancer, and I think I've had you here one. I don't know if it's last year we spoke about some different activities that you guys organize. Please, can you tell us about this year's activities, if you're done already with the activities, and so far what do you think about what you have done and if it has created impact out there?
So actually, this initiative that we created is coming from a foundation called Dr. Thomas Ansuri Foundation, and it is a foundation that is organized to provide a holistic transformation in young people, especially women and girls. And what we do is that we organize breast cancer awareness work, especially during October, where during this walk of life, we sensitize women who are having breast cancer, we sensitize others on the risk factors of breast cancer, the causes, and how to prevent all those. And it has really helped many people compared to the previous years. Because the previous years there was no technology. Now there is technology. There is social media. So this social media, it has expanded people's knowledge, and it has made breast cancer more visible to others. So we are bringing up. Actually, this year, this month, we did not go with the Work for Life initiative because of the tension that was around
exactly
the country now. So we are organizing. We are trying to organize other seminar workshops where we can help practice or activate breast cancer awareness programs.
Okay, all right. Also, you work in a health facility. So tell us, with this now, do you think you've recorded more breast cancer cases, that is at the early stage? You detected it early and you were able to treat it early too?
Yeah, we have discovered that we have tried to detect more in the earlier stages, because back then in Africa, more than 70 cases of these breast cancer cases are more diagnosed when it's at the advanced stage, when it's at the chronic stage. So when we do this Work for Life initiative, we go out, we sensitize people about it. It increases the screening method, where women are now more open to come and make some screening through mammography, X-ray, self-breast examination, and they discover that they have breast cancer in an earlier stage where it can be treated, compared to when you stay and don't get treatment at the later stage. It will be more difficult for it to treat.
Okay, all right, thank you very much. Now let's leave a bit activities and Pink October. Let's dive now directly into breast cancer. We've defined breast cancer. Now we want to find out what are some of the causes and how do you know that you have breast cancer? How does the symptoms manifest?
Okay, now breast cancer is not caused by a main factor.
Okay.
It's not caused by a main factor, but we have risk factors. Risk factors are those factors that expose you to a particular condition. And breast cancer is mostly triggered by a change in a gene of an individual.
Okay.
So now we can categorize the risk factors into two: modified risk factors that can be changed and non-modified risk factors that cannot be changed. I can take an example of a modified risk factor is alcohol.
Okay.
So excessive intake of alcohol is not good for the body. And when you take more alcohol, no matter the amount of alcohol that you take, it can increase your risk of having breast cancer. Then we have smoking as well. Smoking is not good for the body and it is a risk. And we have alcohol, smoking, and other sex hormones. Sex hormones. Women that have sex hormones exposed to sex hormones like estrogen and progesterone. When you're open to estrogen and progesterone, it can help. It can facilitate the outgrowth of that cancer cells, causing more breast cancer. You understand? Then now we have non-modifiable risk factors, where these factors are factors that cannot be changed. For example, age. You cannot change age, and more women are exposed to breast cancer compared to men, even though men are having breast cancer, but it is very rare. So we have age, we have other non-modifiable risk factors that cannot be changed. We have family history. Family history. If you're having a family member that is having breast cancer, there's an increased risk of you having breast cancer. So those are the risk factors of having risk factors of breast cancer.
All right. I don't know whether in your explanation you spoke about food.
Yeah, I think there are certain diets that are not really favorable for people that are having breast cancer. Okay.
So now talk about the symptoms. How do you know that you have breast cancer?
Now the symptoms are very easy. It starts by when you have you do a frequent self-breast examination. When you're doing a self-breast examination, there are things that you have to look in. First of all, a lump. If you discover that you have any lump, a lump is any mass object. It's hard, irregular shape. When you discover that you have a mass and irregular shape, you have to go to the hospital. And a lump is not signifying that you have breast cancer. It can also be a cause of many underlying illnesses. Apart from a lump, you might have a retracted nipple. A retracted nipple is when the nipple is inward. That is, it's inward, it's flat, and if you discover that it's also your nipple is darker, more darker than usual, so it's important that you should know the shape of your breast. Also the shape of your breast. If you also discover that there's a swelling around the breast nipple, then there's a problem. So those are some signs that you have to take into consideration. There's also discharge, nipple discharge. Nipple discharge such as blood, pus, but breastfeeding, if it's milk that is coming out, there's no problem. But apart from milk, you can see blood, you can see pus. So those are signs of
breast cancer. Okay, let's talk a little bit about the rate of prevalence now with technology and everything. What statistics is out there for breast cancer in Cameroon? Is it high? Is it low?
I think the statistics in breast cancer generally in 2022, the last statistic was that it is more than 2.3 million newly diagnosed cases, and it's set to increase by 2040 into 3 million. So with the statistics here in Cameroon, I think the statistics are going down because of the frequent sensitization that we do nowadays. So it has helped us to try to, those people that are having breast cancer and those people that are avoiding to have breast cancer, to have frequent sensitization or screening.
Okay. We still have to talk about the treatment and also prevention. Before that, we are going to have a musical break and then come back to have our discovery page, which Romia Dekume is going to is going to help us with, entertain us with a beautiful musical piece, and also have our discovery page. And in our discovery page, we discover something new every Thursday. Those are health tips that is going to enable us stay healthy. It may be through our diet, it may be through some kind of skincare. Discovery page can be anything, but it's related to health, but not related to our topic of discussion. And it is done by Glory Ngange. Can we have the beautiful? Okay, let's have our musical piece.
If I die, will they remember me? If I pass away, they gonna take my body, not my soul. Le déon rempli de dévianciers, trop de dévianciers, les genoux ils se perdent. Ils veulent que l'argent facile, vendent leur corps et dignité, ils s'en foutent. Oh la la la, that my step out through the joro. Oh la la la, diamba ina diuba. Di da da, esele na itondi taba. Di da da, esele na itondi taba. Je ne veux pas moi les problèmes. Aucune mère ne mérite d'enterrer son enfant. Et piste les étoiles, j'arrive même pas pour les éteindre. Empoisonnement partout cause of jealousy. Don't believe them when I say they're gonna change your life.
Thank you very much, Romeo Adekume. Let's have now on our discovery page the lone slots in the program.
Family Health, our discovery, our discovery.
And for the discovery page is our discoverer, Glory Ngange. Good afternoon.
Good afternoon, Finyo Crispin. Greetings, lovers of Family Health program. Welcome to another edition of our Discovery, in which we will be talking about the nutritional and health benefits of boiled eggs, how it can be consumed and when. Boiled eggs are a powerhouse of nutrition, offering a multitude of health benefits when consumed as part of a balanced diet. They are an excellent source of protein, vitamins, and minerals that can help in maintaining overall health. For maximum nutritional benefits, it's recommended to eat boiled eggs with their yolk intact. The yolks are rich in vitamin A, D, and B12, as well as minerals like zinc and iron. While some may worry about cholesterol, for most people, the benefits of eating eggs far outweighs the risk when consumed in moderation. The American Heart Association suggests that a healthy adult can safely consume an egg a day without significantly increasing their risk of heart disease. However, individuals with high cholesterol or heart disease should consult their healthcare provider. As a general guideline, eating 3 to 4 eggs per week can be a healthy addition to a balanced diet. Boiled eggs are particularly beneficial for eye health due to the high content of lutein and zeaxanthin, antioxidants that protect the eyes from damage. They also support brain health thanks to the presence of choline, which is crucial for cognitive function and development. Furthermore, the protein in eggs can help in muscle repair and growth, making them an excellent snack for those looking to maintain or build muscle mass. Beyond these specific benefits, boiled eggs contribute to a healthy immune system, support weight management by keeping you fuller for longer, and provide essential nutrients for healthy skin and hair. Their versatility and nutrient density make them a valuable component of a nutritious diet. That's what we gathered for you today. Thank you for your kind attention. Remember to keep a rendezvous for the next edition. Finyu Crispin, back to you.
If you're just joining us this afternoon, you're on to Family Health, and we have been discussing breast cancer. It is related to Pink October, a month dedicated to breast cancer awareness, or a breast cancer awareness month. And for that, we have Prince Boateng Asonganyi here in the studio. He is a nurse, and he has been telling us a whole lot of things, and he is equally part of an association which is out to fight breast cancer and create more awareness about breast cancer. We have spoken a whole lot about this health condition. Now we are moving on to the treatment. Prince, how is breast cancer treated, and also can it be cured? If you happen to have it, can you heal from breast cancer?
Yes, breast cancer can be cured depending
Okay.
on the stage, depending on when the breast cancer was discovered.
Okay.
Now, the treatment of breast cancer depend on the stage of breast cancer because breast cancer has stages. It can start from stage 0 to stage 4. Stage 0 is when the abnormal cells are stationed in one part of the breast, one particular part of the breast. And when it's stationed, and when this particular stage is discovered, chemotherapy medication can be given and it can be treated. Now, when you have a breast cancer of stage 3 to 4, that is really an advanced breast cancer stage. And when it's an advanced breast cancer stage, surgery is needed. Surgery is needed to maybe remove part of the breast or remove all of the breast with mastectomy. Now, we have also hormonal treatment because normally there are some hormones that cause breast cancer. When you're exposed to certain hormones, estrogen, progesterone, when you are exposed to certain hormones, that because these hormones make the cells to start growing abnormally. Now, you will be given hormonal therapy or hormonal treatment. This hormonal treatment goes to stop those hormones to occur. And we have also we have hormonal therapy, we have surgery, and we have medications. As in general, we have chemotherapy medications that can be given for you to treat the breast cancer. So in the bottom line is that breast cancer can be treated if discovered early.
Okay. All right. If discovered early, there's this thing that I wanted to ask. Sometimes someone told me about a lady who had breast cancer. They said they cut off her breast. Yes, but later they still discovered that the thing was still continued even though they cut off the breast. What happened? What can happen in this case that she keep having the cancer cells even though they've cut off the breast?
Now, depends on the later stage. As I said, if they cut off the breast, it means it was at the chronic stage of the disease. And this chronic stage is when they remove all part of the breast. And when they remove all part of the breast, those breast cells can transmit to the other part of the breast. So I think maybe they just removed it. They do not have a clearly indication on how those breast cancer cells go. Because when you remove part of all of the breast, and it affects the other parts of the breast, so I don't know how it went before the breast cancer cyst stays there.
All right. Let's talk about prevention. We have limited time. Let's now talk about prevention. I think this is the most important part. How to stay away from breast cancer. How to prevent it.
Now, how to prevent breast cancer is when you start doing early breast self-examination that can occur. It's mostly advised to do it only after your period, when your breast is less tense or dense. And when you do the self-breast examination, you're looking for a lump, you're looking for swelling, you're looking for thickening, you're looking for nipple discharge. So all those, if you discover any of these, you have to reach out to the hospital. You eat a balanced diet, you avoid smoking, you limit alcohol, because if I say avoid alcohol nowadays, it's very difficult for people to avoid alcohol. So we limit the amount of alcohol that you take, and do more physical exercises like walking, jogging. All this can prevent you from having breast cancer.
Okay. All right. Other things. Let's come back to your association. You said it is the Tumasang
Suri Foundation.
Okay, Tumasang Foundation. Tell us now. You guys are concluding the month. What are other things that you're planning to do? Are you having any other activities that you're planning to do?
Yeah, we are having many other activities that we are planning to do, since we do not really have that Work for Life initiative. So we are planning in the months ahead, we will be having some general session, seminars with people where we can explain them and educate them about breast cancer awareness, the causes and the risk factors. And we also have some kind of football activity where women will come together, and we are also having a national coalition where we have Women Against Breast Cancer. They come together and try to support those people that are having breast cancer. And we also try to organize fundraising, where we take this fundraising, because last year I can remember we sum up with amount of 45,000 to 50,000 funds. where we took the money, we went and visited breast cancer patients, and all this helped breast cancer patients to show that they are involved in the society and they are included in the society.
Okay. There's something that just came to my mind when we're talking about prevention. They say breastfeeding too helps prevent breast cancer.
Yeah, breastfeeding too help prevent breast cancer in such a way that when the baby is sucking, it activates that breast cells, and when the breast cells are activated, it helps the breast cells to stay healthy. Now, there's another myth that is compared to when they are sucking your breast for pleasure and the baby is sucking for breastfeeding. Those are two different things. Yes, also
that's also important.
Very important. Sucking the breast for pleasure does not do anything. There's no effect.
There's no effect.
There's no effect of it. The most important thing is breastfeeding. If the baby is able to breastfeed and milk is able to come out, then it's good.
Okay. Another thing that Pink October they will start saying
that
you need to to prevent breast cancer. People should allow women alone. Only breastfeeding prevents breast cancer. That means if you want to prevent it, you need to be breastfeeding every year now.
Not really every year. There are other preventions that you can do now. It's not only breastfeeding that can prevent.
Okay. All right. Anyways, thank you very much, Prince Boateng Asonganye, nurse, for coming today on Family Health.
Thank you, Crispin.
Okay. Hoping to have you another time.
Yeah,
this one that you've come almost at the end of the year. That means we'll have you again at the beginning of next year.
No, if I have time, I'm going to come.
All right, thank you, and thank our beautiful listeners for following us on Family Health this afternoon. Hoping to have you next week same time. Romia Dekume was our sound engineer and our studios clerk. Brian Bida was our video editor, editorial coaching Abel Bida Summary, coordination Roger Kiekan, for general supervision the Reverend Pastor Bisai Emmanuel Noel. For presentation, I have been Fringe Crispin, hoping to have you or have myself by God's grace on the program Family Health next Thursday, and have a blessed day. Anyways, time for us to welcome Teofila Wana